Hi, my name is Dr. Swati Bhat. I'm the Director of Interventional Pain and Spine Center, IPSC, Bangalore, Sahakarnagar. Most often patients come to our clinic with the complaints that they woke up with a very severe pain in the neck. Most often the reason is that the patient would have slept in a very odd position, and once we sleep in an odd position, there's a tendency of the body to go in an unsafe position, wherein the body tries to rectify this and the muscles go into a spasm with the intention of causing not a damage to the spinal cord. So it's a protective mechanism which the body innately has. Now when these muscles go into a spasmodic condition, that is when it brings about the pain. So most often these patients come with a spasm either of the neck or of the low back. So this is what is a spasmodic pain. The other reasons or the serious causes could be a slip disc or a disc herniation, what we call it, or else it could be facet joints involvement in the neck, which is again a degenerative condition. So these are most often the causes with which a patient may present to us with neck pains. Have a healthy sleep posture. One of the commonest myths of neck pain or spine pain is if you have a pain, please do not use pillow or sleep on the floor. These are all myths. They do not have any practical basis. So as an individual with or without pain, my suggestion and advice is to use a pillow. Your neck needs a support. It has a curvature which needs to be maintained. So when you are sleeping, please maintain a soft pillow. It may not be of a very height, but should be adequate enough to give your neck the support that it deserves. Second, whenever you have a neck pain or otherwise as well, try to do your certain movements like looking upwards, looking downwards, looking from one side to the other side. If you get any pain, which means that there is some dysfunction or there may be something which is underlying which needs your attention. Third, last but not the least, neck exercises go a long way. So do not do any rigorous exercises without any trainer who has attained a good certification. So if you're going for any of these exercises, they will maintain the stability of your neck muscles and make them stronger. So simple exercises like looking upwards, downwards, maintaining a long gaze on either sides of the muscles, and resistance training. These are all the exercises which will go a long way to make or retain your muscles of the neck healthy. If the conservative therapy for neck pain fails to give adequate improvement, the next step should be to investigate the source of the pain. Investigations like MRI and clinical examination of the neck is very important. Once you have arrived at the diagnosis, which could be either a disc herniation or inflammation of the small joints in the neck, which is called as the facet joints. If any of these conditions is prevalent or is present in the patient, then interventions like cervical epidural or cervical facet joint block, a medial branch radiofrequency ablation, in which we make the nerves supplying these joints numb over a prolonged period of time, wherein which the patient undergoes a natural healing of these joints and may be relieved of this pain forever.